Hello and welcome everyone. I am in presence of Dr. Juginder Luthra, who is a practicing ophthalmologist for over 50 years and has extensive experience in what he's going to talk about today, about eye movements, how they help us, what are the benefits of practices with eye exercises and so on. So over to Dr. Luthra.
Good morning, everyone. Thank you, Dr. Bakshi. I have been practicing ophthalmology for, like you said, over 50 years. And over the years, we sometimes see the results of not exercising the eyes later in life when it is kind of late. So therefore, it is better to be proactive and try to do things that may prevent us from getting to those diseases, which may be preventable sometimes. To understand the eye exercises, like I've learned from this platform, that it is best to visualize the muscles and the nerves and so on that are working to do the magic that we use and take for granted every day. And when we exercise those muscles, then if we can see them, then we can put our mind there so we can do more mindful exercises. We can connect the breath with the exercises so that the energy or the chi reaches the areas that we are trying to work on. So what I have seen briefly over the years is that when we check our patients, especially older patients, when we ask them to look to the side or look to the down, they can do all that. But when we ask them to look up, their eyes stop at about midline. Eyes would not go up. And the reason is that most of our life, we do not spend looking up. Because most of the things of interest are ahead of us or below us or to the sides. Similarly, the upper eyelids, they have a muscle that hold the lids up. And if we do not exercise it, they droop down because of disuse. The eyelids have to have a certain kind of a tone in them to keep them up against the eyeball. And if we don't exercise those muscles, then we lose the tone, and invariably the lower lid will sag down, or the eyelashes will turn in and rub against the eyeball. And some of these exercises that we'll do address those issues. That's the eyelid part of it, and the eye muscles part of it is what we'll start with today. We have, like any other part of the body, which works like a puppet. The puppeteer has a string attached to the parts of the puppet, and when the puppeteer pulls the string, the part that is not attached, it moves toward the string puller. Same way, the muscles that we have in the body and of course in the eye are like those strings. On one end, they are attached very firmly to a bone. On the other end, they are attached to the moving part. Easiest example to see is that if I have my hand stretched out and I want to pull my hand and the forearm in, it comes in because the signal from the center brain came to the biceps muscle that you please contract, and it does. So when it contracts, it pulls the elbow up, and so the bicep works. And in the eye, we have two sockets in the skull. Each socket contains an eyeball, which is the size of about 1-inch diameter ball. It's a very refined movie camera. And the eyeball is connected to 6 muscles that move it. 4 of them are straight and they attach to the back of the socket, and they come forward and they hook into the eyeball like this on the top, hook like this on the side, at the side and below. So these muscles move the eye down, up, left, right. Then there are 2 muscles we have that go around the eyeball. They do the torsion movement. They rotate the eyeball. So it's a combination of these 6 muscles in each eye, and which are well coordinated inside the brain, that if I move my right eye, my eye to the right one will move out and the left one will move in. They move exactly same amount. The purpose of them moving same amount is so the two images that we are taking, they are superimposed on each other, and we do not see double. If they are a little bit misaligned, the images go like this. So now we don't see two, we don't see one image, we actually see two. So we get diplopia, double vision. And that is coordination is done inside the brain. And if the muscle gets weak for some reason, the signal coming from the brain is fine. But if the muscle is weak, then also the same thing will happen. The one eye will go full swing, the other one, which is weak muscle, will not go full swing, and the image will split and we see double. So knowing this anatomy, we have exercises that we do. The first exercise that we do is to take a deep breath, get all the oxygen in, and calm yourself and get ready for the exercise. And if you want to chant the mantra Om for peace in us, around us, that's the way to go. So having taken a deep breath, then what we do is first we do is what we call as palming exercises. So we rub the hands, generate some heat, and then put them up against the palms against the eyeball and hold it a few seconds, and then come back and do the same thing again. So this has a calming effect on the eyes and the mind, as well as it may provide a little bit of heat to the eyelids. And that gives some comfort and relaxation. Then the next exercise we do for the eye muscles, like I mentioned earlier, that we move the eyes in different directions, but we don't move them up very much. So to do that, we need to work each muscle. Now we know the anatomy, so let's start. So first thing we do is to do the eye rolling. And the eye rolling will be done by looking straight at any object, like a clock on the wall or something. You fix it on that wall, on that object, and then move your eye up and to the left, as far as you can go. And then you go straight up and to the right, as far as your eye will go, to the right, down and right, straight down and left, to the left, up and left, and come back to the clock. And you repeat that one more time. Each exercise should be done slowly. Number one, to get the best benefit of it. Number two, you don't want to jerk the eyeball. So go up and to the left, straight up and to the right, down and right, straight down and left, to the left, up and left, straight up and back to the clock. Then what we do is to create a figure in your mind and follow that figure and that helps you with the eye movements and using all the muscles. So we look straight at the clock again and imagine a figure of 8 in your mind and start following the upper circle of the 8, beginning in the center, going to the left, up and left, follow the top of the 8, my right side of the 8, lower side of the 8, coming down to the clock in the center, and then to the left, lower part of the 8, down below, down and right, upper loop of the lower circle, come to the center, hold it, and then do the same. Follow the left upper loop, the top, to the right loop, lower part of the loop, come to the center, go down and left part of the loop, down below, right part of the lower loop, and come back to the center. And that gives you a figure of 8. Follow the movements. One can visualize a square or a rectangle or a triangle and just form that in your mind and follow that with your exercises, with the eye movements. And that gives you a certain variation of the use of the eye muscles. Whenever we are moving our eyes in different directions, like I said earlier, we move them in one direction or the other, and both eyes follow, except when we are doing close work. Whenever we are doing close work, I need to have something close to me to read. So therefore, the right eye has to come to the left side and the left eye has to come to the right side. So the two eyes are converging onto the book or the telephone or the iPad, whatever we are looking at. This process or this movement of the eyes is called convergence. And when we look at something close by and then look at outside, that is called divergence. So the eyes are diverging from each other or they're converging toward each other. Sometimes there is a disease, something we call it like convergence insufficiency. So to improve this mechanism of convergence, what we do is we have an object like a pen. So if you hold a pen at the distance of my arm length, and I look at the tip of the pen and gently, slowly bring it toward me, keeping my eye focused at the tip, and keep bringing it in, keep bringing it in, keeping your focus onto the tip of the pen. And it'll come to a point where eyes will give up and will not be able to focus like this. Now I suddenly see 2 pens, which means that I've gone a little too far. So I need to back off a little bit till it becomes 1. Then hold that. 5, 4, 3, 2, 1. And then back off. Arm length distance. Look at the top of the pen. Bring it toward me. Keep doing it. Keep your focus. And here, then hold it. 5, 4, 3, 2, 1. Let go. So one can repeat that exercise at least 5 times a day, especially if you have convergence efficiency, or if we are using a lot of time, which we do these days on the tablet or the iPhone for our work or reading ebooks and so on. So this exercise will help with the strengthening of the convergence. and therefore reduces the eye strain. We also like to do something, we call it focus shifting. When we are doing the close work for a long time on, again, tablets or iPhones, so to do that will be to hold the pen about 8-9 inches from you, finger is fine. So just look at the top of the finger and focus on it. And then shift your focus back to the wall, about 15 feet away. Have an object there, focus on it. If it's a clock, you focus on the needles of the clock, and your eyelids, eyes are focusing on that. And then you shift your focus close by on a nearby object at the pen tip or a fingertip, and then shift your focus back. Our focusing mechanism is done by some muscles inside the eye. Whenever we're looking at a far object, the light rays are coming in a straight line, supposedly, and then they converge onto the retina. But if we have an object close by, the light rays coming are divergent rays. They are not parallel. So the eyeball needs more focusing power to bring that into sharp focus within a span of 1 inch. And therefore, the way the eyes work is that there is a muscle inside the eye that contracts, which makes the lens of our eye become more plump when we're looking at a near object. This use of that muscle needs strengthened by shifting the focus, and that way also it reduces our eye strain. There is a myth that goes on that by doing exercises, we can eliminate the glasses. That is not true. We do not eliminate the use of the glasses. We make our eyes more comfortable. We make them stress less, and that is helpful. One other rule that we should follow when we are using the e-books or doing a prolonged work on the computer, especially during COVID days, all the children, everybody else was on the screen for a long time. So there is a rule, we call it 20-20-20 rule. 20-20-20 means that if you look at the screen for 20 minutes, take a break of 20 seconds, in which you look at an object which is at least 20 feet away. Again, it is doing the changing the focus. So the ciliary muscle, which was working the whole 20 minutes to give us the near vision, now it needs relaxation. So by looking far away beyond 20 meters, it gives you relaxation of the ciliary muscles. So that 20-20 rule is very useful in prolonging the use of the screens or iPads or iPhones for longer without getting too much eye strain or headaches and so on. So these are some of the exercises that we do to ensure that our eye muscles are working and working without giving us too much eye strain or headaches, etc. There are in the second section, we can do with the eyelids. So if you want to take a break at this point, and then we can do the eyelid part later.
Yes. Thank you very much, Dr. Luthra. That was an excellent presentation with the visualization of all the muscles. And I'm sure everybody will benefit from your hand showing of the muscles in the hand and all the exercises done. So thank you very much for this wonderful talk.
My pleasure. Thank you.